Hello, everyone, and welcome to today's podcast. The human mind is one of the most fascinating and complex aspects of human life. From emotions, relationships, to trauma, violence, and behavior, psychiatry helps us understand the deeper psychology stories behind what we see in our surface. Today, we are honored to have Dr. T.V.Asokan with us, a highly respected psychiatrist, academician, and a mentor known for his years of experience in understanding human behavior and human mental health. Thank you so much for joining us today, sir. Sir, psychiatry is a field that requires not only medical knowledge but also immense emotional understanding. What initially inspired you to choose psychiatry?
Yeah, during my third year posting, I attended a class in psychiatry. My professor was demonstrating a case. We interview the patient, and from the interview, we get the complaints. But interviewing the patient in the medical OP or the surgical OP is different from psychiatry. Patients attending psychiatric OP, they are mentally ill. They may be uncooperative, they may be reluctant to disclose very sensitive information. But my professor was talking in such a way that the patient was interested in listening to him. Second, my professor was listening in such a way that the patient was interested in talking to him. I learned two things of communication. Communication involves talking and listening. To understand the agony and suffering of the patient, unless until you be in the perspective of the patient, you can't really understand. And for that, you need empathy.
Yes.
This is one. Another case he showed me, a person who was extremely depressed a few months back, harboring negative ideas, almost to the extent of going for terminal exit. He was treated with antidepressant and non-pharmacological intervention like psychotherapy, and we were able to see the laughter in his face. That was a dramatic change. At that time, my professor said, you be proud of being in psychiatry. For other specialties, I think if they had years to life, psychiatry is a profession which had life to years. That was an inspiring, motivational moment for me.
Okay, sir. Over the years, has your profession changed the way you personally observe people and human behavior?
Very much. See, when I was an undergraduate, I think psychiatric facilities are not available in the rural side, even in the urban side. The person with the mental illness is to come to the district headquarters hospital or psychiatric units functioning in medical colleges. And the drugs that were available up to 100,000, they were conventional antipsychotics. You may be knowing about positive symptoms or negative symptoms in psychosis. For example, imagine a person is talking 40 words in a minute. And in case of excitement or in an extremely, excited level of psychosis, he may be really exceeding 80 to 100 words per minute. This is a positive symptom. Or the same person, if he's going for a depressive level or a retarded state or catatonic state, he may be communicating in a minimal set of words, 5 words, or he may become monosyllabic. This is a negative symptom.
Okay.
What I'm trying to reiterate, amplification of a particular variable or accentuation or exaggeration of already existing variable is a positive symptom. And diminution or disappearance of the already existing variable factor is a negative symptom. All these conventional antipsychotics, they were addressing only the positive symptoms and virtually they are not having any kind of effect on the negative symptoms. And these negative symptoms are responsible for personality deterioration and the persons are incarcerated and becomes like vegetable. And so there was an impending need to really keep them for months, years, and deterioration was happening. But with the advent of atypical antipsychotics, they were addressing and alleviating the negative symptoms. Things are easier for psychiatrists. No, we don't admit cases now. I mean, drugs are beautifully now addressing all these positive and negative symptoms. Very rarely, I think cases that are excited, dangerous to self or dangerous to others, are having poor drug compliance. They only admission for a short period. And not only that, psychiatry is probably refurbishing with the advent of technology. With the advent of technology, now we are living in the digital world.
Okay.
And there is enormous amount of behavioral addiction. Psychiatry addresses. It is not only addressing and alleviating the problems of psychosis or neurosis, but also interpersonal issues, stress tolerance, emotional quotient, and ordinary lifestyle problems. Everything, no, psychiatry addresses. And we keep pace with the development as well as changes in the existing culture or in the social media.
Yes, sir. After interacting with so many patients over the years, what do you think one human aspect that surprises you the most?
Sorry?
What one thing about the human mind that is still surprising you the most?
Yeah. The malleable nature of the mind. See, mind is more. At one particular point of time, I think mind is not in a position to understand the abilities or the capabilities of an individual. The person is not believing in his self-esteem. He starts on facing a particular problem. He starts really, concluding that it is not possible to overcome that particular conflict. But with the intervention of psychiatry, with the intervention of non-pharmacological management, as well as, if necessary, drugs, the same individual, the same mind is probably, trying to visualize it in an ordinary problem, and it learns from the experience. And what was considered as serious or catastrophic is no more serious, and it is just an ordinary problem. So what I'm trying to say, practice, perseveration, that can change the mind. Another one, the sexual aspect. Mind is the first sexual organ. If the mind is not tuned, if the mind is not conducive, I think that is probably, even that individual will not have any kind of inclination in sexual area. Another one, there is something called mind should be there at that particular moment. See, you prepare for an examination and you read and 4 times or 5 times and able to keep everything in the rote memory, or not in a position to keep everything in the short-term memory, or not in a position to transfer whatever is stored in the short-term memory to long-term memory. But imagine a situation where you watched a particular movie in a theater 3 months back. But if you're asked to really know and come and repeat the particular movie scene, you'll be in a position to repeat it frame by frame, because at that time of watching the movie, you were interested. That was your passion. You are able to focus. You are able to really, be attentive. And whatever is learned with proper attention and concentration with interest or a passion, that is probably beautifully registered. Retention is good, and recall is probably fantastic. This is the aspect of mind, and this is surprising. And sometimes we talk whatever we think. Surprisingly, we talk, even we may be thinking something else, but talking something else.
Yes.
And sometimes we may not be knowing what exactly is stored in the subconscious or unconscious mechanisms, whether we learn from the previous experiences to the fullest extent. This is all mysteries of mind.
Okay, sir. Now, without revealing the identities, of course, what has been one most psychologically fascinating or unforgettable cases you have ever encountered in your career?
Yeah, I was working in a government college. I think there was a North Indian student, and in the second year, no, he was not attending the classes, and he was smoking cannabis, and he had become dependent to cannabis and also alcohol. And the warden, a good friend of mine, he brought him along with his parents. At the surface level of inquiry, it was probably, looking like a drug dependence diagnosis, alcohol or cannabis. But on perusal of further information, we came to know that it is a subtle and mild form of depression that was precipitating and perpetuating this drug dependence. And we put him on. In fact, we admitted him for a brief period. We treated him for drug dependence, also for depressive phase of bipolar disorder, and he became all right. And he was on maintenance medication. He completed the course within 4.5 years, and that too with a gold medal in a clinical exam. That was the gratifying moment for the Department of Psychiatry,
Okay.
where I worked.
Have you ever come across a patient whose behavior seemed shocking initially, but later they revealed a deeper emotional trauma or psychological conflict underneath?
That is the girl who, when in the college, I think, suddenly started behaving abnormally, in a mysterious way, started finding fault with her relatives, parents, and stopped going to the college. And she was indulging in self-inflicting behavior. She was not sleeping properly. An academic decline was noted. And during the sleep, I think suddenly she, starts screaming. and nobody was able to decipher the reason for it. And she was brought to a department. We came to know that I think a man of her father's age tried to misbehave with him. That was a real shock to her. She was not able to believe such an elderly person of her father's age. I think he was making sexual advances, trying to misbehave. And this was not unacceptable. In fact, she stopped maintaining gaze with any male, even in the Department of Psychiatry. I think she was avoiding gaze, and she had a very bad opinion. And we took long time to really convince her. The person, the perpetrator, probably it was a casual misbehavior. The axe soon forgets, but the tree remembers.
Yes.
That was one disturbing case, still occupying my cognitive realm.
Are there certain cases that stayed with you emotionally long after, even after the treatment?
Yeah, definitely. Definitely. The young child, I think, well, as a child, he had an emotional and physical trauma, and subsequently became all right, and he was not properly communicating. We have diagnostic as well as a therapeutic interview. For a joke, he started laughing. And such a serious person, when he laughed, it was like witnessing a flower blossoming. That was an aha moment for us. An adult, I think, very successful outside, but inwardly, he was having his own reserved ideas. He was longing for his company, and he was not really believing any person. He was almost like a solitary leaper with limited interest. We suggested some measures to have some meaningful relationship. Yes, he had some layers of emotional problems. After having meaningful relationship, I think he started having a better quality of life. Because these two illustrations, what they reveal, human beings are always longing for empathy, understanding, and sometimes without help, I think when you face the problem, you get the resilience. When you are entering in untested waters, and probably, somehow I think you really fight over the situation and you start seeing the resilience. These are all the intricate, surprising aspects of human nature.
Sir, people are often fascinated by criminal psychology and mind that behind the violent crimes. So from a psychiatric perspective, what factors shape such extreme human behavior?
Offense is something, an activity which is not accepted by the society, and this is punishable under law. Offense is committed by ordinary people as well as persons with a mental illness. Coming to psychiatric population, the person who is having psychotic conditions like schizophrenia, when he's having a disturbed thought process, deranged thoughts in the form of delusion. Imagine he's got an idea that others are following, trying to harm him or trying to kill him. And probably, without any kind of provoking, he started indulging in violent tendencies. This is one. Second, the hallucination, especially the auditory hallucination, which may be commanding or commenting in nature, he may be trying to resist that hallucination. Beyond a particular point, I think he started yielding to the hallucination and commits an offense. This is happening in schizophrenia. Coming to bipolar disorder, especially in the manic phase of bipolar disorder, there is something called impulsivity. Suddenly, there is, we always know, we react and we respond. Reaction is something immediate without knowing the consequences. Response is little delayed. When the person is probably responding, he is aware of the consequences. In case of an individual with bipolar disorder, especially mania, the person is impulsive, he is immediately reacting. This is one reason. Third, substance abuse, either alcohol or cannabis or any synthetic drugs. These drugs may really, dissolve the superego. Under the influence of alcohol, the person is not in a position to know about the nature of the consequences of the act is committing. This is what. And he may be really, trying to really experiment all kinds of perverted wishes. Four, he would have been subjected to previous emotional trauma or sexual abuse. That may be the reason. Or any history of head injury, and that could have precipitated unwanted personality traits. Personality disorder, especially psychopathic personality disorder, These people, they don't have any kind of emotional concern for others' emotions. Why others? Even for their own self, I think they do not have any kind of a concern for their own emotions. And second, they have a kind of emotional inconcreteness. And you commit a mistake. Nobody is free from committing mistakes. You commit a mistake, you'll start learning from the mistakes. But unfortunately, these people, they fail to learn from their previous mistakes. And these are all the psychiatric causes. And not at the personal level. And a social level, emotional factor, not having any meaningful relationship and not having a structured family, not having a proper role models, cultural silence, and communal inequality. And I think the mirroring the society where there are some people who have really achieved success by means of violent tendencies, they are probably imbibed. These are the other causes for indulging in offenses.
Yes, sir. Are people with violent tendencies born that way, or behaviors usually shape up by trauma, upbringing, environment, or emotional neglect?
Yeah, criminals are born, criminals are reared. Both the answer is right. But here, there is a difference. I mean, criminal, ordinary person committing an offense and becoming a criminal is different from a psychopathic individual committing a crime and probably achieving something.
Okay.
Imagine a situation where somebody want to have 100 rupees or 200 rupees, the reward, and he may be really, was threatening the individual at a knife point, and he may not go beyond this level to get that 100 rupees or 200 rupees. If the person is a psychopathic individual and he wants to get that 100 rupees, he may not mind to kill the person with multiple incisions with a knife or multiple shootings with a revolver or some other pistol or any other weapon. And this is the state of affairs of psychopathic personality. Yes, there is a biological disposition. Sometimes there is a genetic disposition. These are all reasons at the personal level, but not all people they go for criminal tendencies. The reasons are multifactorial. Problems at the personal level and problem in the family where I think the family is not properly structured and separation, divorce, or absence of father or parental figures and cultural factors. They also play a very significant role and childhood factors also play a significant role, whether the individual is abusing drugs or previously would have learned this as a kind of seeking reward by this mechanism. So the results are multifactorial.
Okay, sir. What's one common misconception and is that every criminal must have psychiatric illness? How true is that?
Because there is a cause and effect relationship, just overlapping is there, but it is limited. Need not. I think after becoming criminal, the person, after committing an offense, I think when undergoing punishment, there is a possibility of having psychological problems. This is one. Patients, persons having psychological problems, probably they commit crimes and they become criminals. This is another. I will not say there is a direct cause and effect relationship existing, no. But there is an overlap, but that is limited.
Okay, so. So, the incidence of violence against children often leaves society deeply disturbed and searching for answers. From a psychiatric perspective, how do we begin to understand the psychological and social factors that can contribute to such extreme behaviors?
Yeah, child sexual abuse is another underreported factor because of the cultural silence. Our community is probably indifferent in certain cases because of the perceived stigma. Quite often we think that the perpetrator may be from a very remote place or unknown or he is from unseen places. No, not at all. He may be very close relative, frequently visiting the family, known to the parents, known to the child, and he may be really playing with the child, and there is something called trust grooming. Trust grooming is nothing but winning the confidence of the child. Every time when he's visiting the family, he used to get some gifts or chocolates or sweets for the child, and he may be playing with the child, and child may be really liking his company, and he'll be waiting for a particular private time to execute his behavior. And the child, he may be really misbehaving, the child. You may be knowing about the good touch or bad touch. And the child may not be, sometimes the child may not be really perceiving it as a problem. I'm talking about the bad touch, touching somewhere in the genitals or somewhere in the other areas, prohibited areas. The child may be perceiving it, oh, this is the way of showing affection towards the child. And the child started perceiving the problem, especially with the penetrative penetrative acts, or some bleeding injuries or wounds. And this is quite often underreported. Sometimes it's committed by second degree step by the relatives or even stepfathers, and very rarely, by biological fathers when they are in altered state of consciousness due to drugs or alcohol, or both the people are schizophrenic, extremely deviant. Yes, sometimes it may be occurring in incestuous relationships.
Do cases like this reflect psychological disturbance with the individual alone, or they reveal a deeper societal problems that we may be ignoring?
Yeah, this is probably, imagine a person is probably having a personality disorder, person having a substance abuse problem, or the person who had been previously victimized. I think he may be repeating. The cycle of harm is probably repeated. Now I was victimized. Let me also really become a perpetrator, and let me also abuse another child. That could be the cognitive status of the perpetrator after growing. Or probably, this is sometimes a person may be having some problem about his identity, sexual identity, or he may be having doubts about his performance, or he may be reluctant to really, initiate a conversation with an adult male or a female, or probably he may be really worrying about the performance anxiety. If I were to really have a sexual relationship with the adult female, I don't know whether I may be really having adequate nuisance or erection to really, make the girl enjoy my sexual relationship. That could be one suspicious idea which could have driven him towards the soft target. I'm going to have sex with that child, and child is not going to retaliate, and child is going to accept it. There is no problem. There is no kind of anxiety. No, child is not going to make a complaint. And this is also, but they are soft target, and they have a kind of a vicarious courage with the children.
Okay. Do factors such as violent content exposure, substance abuse, pornography addiction, emotional neglect, or social isolation contribute to these crimes?
Yes, very much. Especially with the pornography. I think this is unlimited. And sex is a kind of an experience, but unfortunately, after getting exposed to pornographic material, many people know they think in terms of an experiment. Sex is not an experiment. I think both the people should really enjoy. It's a beautiful experience. It's a beautiful communication. It's a kind of an intimacy. But what exactly is happening is a kind of a dominance. Now, by letting out your aggressive feeling, somewhere you would have been really, upset. You would have been embarrassed or intimidated, and this is probably, gratified by dominating a female or dominating a child. And here, even the sexual abuse or rape with an adult female, it is not the exact sexual pleasure they are looking for. I'm trying to really dominate this person. I'm showing my aggressive impulses. Somebody is subjugated. Somebody is not crying. This is enjoyable. This is gratifying. More than the sexual aspect, the person is trying to control another person, dominate another person. This is probably reigning supreme in his cognitive realm. This is the important factor. Second, alcohol and substance abuse. I think superego is soluble. You don't know what is happening, and you are indulging in certain activities where you don't know or predict the consequences.
Okay.
So this alcohol is adding fuel to the fire, and especially in group drinking or group sexual abuse, I think they have a kind of an attitude. I'm not, all the four people are there. When an individual is probably, committing an offense is different from but rape by a gang. There, I think the fear or anxiety of being caught by the police, this diluted. Somehow, I think even though there are three or more people involved in this, I think I may not be, somewhere I think there may be a courage, vicarious courage, that may be really, making them to really indulge in this activity.
Yes. Incidents like this also deeply affect the public psychologically, especially parents and children. How does collective fear and trauma impact the society?
You have to be careful. I think you can't really, the child, we used to tell, even the male child or the female child, the child has to be separated and the child should be kept away from the male after some time or even after second year and third year, whatever it is. And we must teach the children about good touch and bad touch. And we must know where the child is there. I think even for a minute or 5 minutes or 10 minutes, I think the whereabouts are not known. I think there is a risk. You need to know where the child and how the child is behaving. Imagine a psychological problem for which we are not able to explain any reason. It could be sexual abuse or child abuse. We used to say, if an elderly person, if an adult person is presenting with physical complaints for which there is no physical or organic basis, think about hysteria. And this is with reference to adult population. In a childhood population, if the child is presenting with some problems for which you are not able to attribute any psychiatric diagnosis, think about child abuse or sexual abuse.
Sir, from your observation, what are some major mental health concerns currently affecting the younger people today?
Yeah, with the advent of the technology and with the Gen Z population, I think they are concerned about instant success. I'm really happy to see people know they are openly communicating. Absolutely, they don't bother about, they have information overload and digital toxicity is there. And they really think about instant success. If it is not achieved, they go for anxiety and depression. And they have a gadget, a smartphone. With that, I think they're able to get anything and everything. They need not go to the theater to see a movie. They need not go to the grocery shop. Everything there is an app. And so they start thinking that they become omnipotent and they become extremely independent. Not so. Man is neither dependent or independent. He's interdependent. And they are worried about achieving success. They keep on extending the goalpost, but unfortunately fail to remember that we learn only from our failures. Failure is an experience. Failure is a stepping stone. Unless until you really understand your failure, I don't think you will definitely perceive what success is. Anxiety and depression and drug-seeking behavior. This is another problem. Third, I think they are not really emotionally competent, emotional quotient. I know they are extremely intelligent. They know everything or something of everything, but emotionally they lag behind. But they need to have a proper emotional quotient, understanding one's emotions, understanding others' emotions, understanding the interaction between one's emotions and others' emotions, and trying to get the best beneficial effect. And stress tolerance is very, very low. They are extremely emotionally, aware of so many issues, but unfortunately, they're not able to really, operate their coping strategies at the right time for the right problem. This is another one. In spite of having everything, they have comfort, education, knowledge, intelligence, relationship, and the intimacy, relationship, sexual activity, everything is happening in the digital spaces. But in spite of it, they have one problem: loneliness.
True.
I think in our generation, I think even the orphan was not complaining. Orphan, he was not having anything, he was not possessing anything. Even that orphan was not complaining loneliness. He was longing for food, longing for shelter, asking for possession, but he never complained about loneliness. But unfortunately, in spite of having everything, the present youngsters, they are complaining of loneliness. Loneliness is going to be the future epidemic in the digital world.
As students ourselves, we often witness burnout, anxiety, loneliness, and emotional suppression among peers. How many young people hesitate to speak openly about this?
Now they talk openly, but unfortunately, I think they fail to learn from the experience. You know, the family system, I think it's probably, little distilling and distorting. In a family, I think family has become isolated islands. Now everybody is, comfortable with a smartphone. Virtually, the communication is not existing in the family. It should start with the family. I think there should be, a digital holiday should be there at least on Sunday, and all the family members should eat together at least in the afternoon, and they should freely communicate. And when you go to some places, I think please visit without cell phones. And they fail to remember one important aspect: life exists in offline only. And the present generation fail to remember another aspect: they don't have meaningful relationships. They have 5K followers, and probably they have likes and dislikes. They have probably they are dragged into narcissistic hunger, and more than that, they compare with the celebrities. Life is not something to be lived and left with a script written for others. But unfortunately, these youngsters, they do that.
True. How significantly has social media changed the emotional well being and the human relationships?
Relationship had become business. Openly, they disclose information. Some of the sensitive issues, I think the present generation on the social media is really making. Openly. It's almost like entering into a contract. Very openly, they say, I'm interested in you, shall I marry you? Without any tinge of emotion, I think the present generation is making this statement. And he starts proceeding with that. But he lacks emotions. The costliest mistake the present generation is doing that they are avoiding, they are neglecting one important aspect called emotional paradigm. Logical paradigm, yes, reasoning out. Emotional paradigm, you feel the emotions. But I think both should balance each other. They should not become a seesaw phenomenon. But unfortunately, I think they go by information. They rule by reasoning or logical or intelligence, and ruined by lack of emotions.
Now we'll reach these rapid fire rounds, sir. What is one dangerous psychological habit society has started normalizing today?
The ends justified justifies means. If I remember correctly, Nicholas Machiavelli, in his Prince book, I think he says consequentialism. Achieve something good, and to achieve that, you can do anything. There are two sayings. One, if the path is beautiful, inquire where you are reaching. If the destination is beautiful, don't ask about the path.
Okay.
Both are correct and both are incorrect, but there is a kind of an ethical egoism. It probably, conveniently, the political principle preached by Machiavelli, I think they want to achieve success, but there is a way in it. And they fail to remember two things. They look for happiness. They equate success with happiness, but they fail to forget one important aspect called satisfaction. Happiness is between what you expect and what you get. I repeat, happiness is between what you expect and what you get. But there is another level, higher level, satisfaction. Satisfaction is what you get and what you, in between what you get and what you accept. You start accepting. Are we not accepting our friends, father, mother, parents, children?
Of course.
We should also accept our present state.
Sure, sir. What's one thing society misunderstands the most about psychiatry?
We are, see, we are but not only the lay people, even the colleagues, they think that I think we are dealing with the mentally ill and probably magical religious thoughts were probably the first comment or criticism. Second, they think that drugs alone, we are playing with few drugs. No, it's a clinical medicine. And at the same time, I'm not really restricting psychiatry with the biological principles alone. It is a multifactorial, it is an abstract subject. To be a psychiatrist without empathy, you cannot become a psychiatrist. This is one. And still, it is surprising. And still, I think whatever, in every man there are two men. One man is sleeping in the dark, another man is awake in the light. We are worried about the man who is awake in the light, but unfortunately, we try to understand the man who is sleeping in the dark. Even in the best psychiatrist, whatever he observes, I think he just observes very little. It is very, very difficult to analyze, understand, decipher the human mind. We have produced so many things in artificial intelligence. Till now, they are not able to produce psychological consciousness. With the metadata, with the predictive diagnosis, fantastic. They are able to really pinpoint this factor, that factor. But till now, I think artificial intelligence is failing with reference to production of psychological consciousness. And even in formulating humor, it is really excelling the human humor with reference to logical humor. But emotional humor, it's still one level below than human being. This is all the fascinating one. But unfortunately, we are blamed that we are putting the individual for lifelong treatment. No, no way at all. Only very rarely, no. I think we treat the people and we ask the people to continue the drug. But unfortunately, the people who really blame us, they fail to remember that for hypertension or diabetes or any other problem, they have to continue the medication. And in a very humorous way, we used to respond. Sir, should I continue the drug for lifetime? Your lifetime or my lifetime? Probably that is the answer.
After years in psychiatry, what do you think that human mind truly craves the most?
You need to last question. It's the last question.
Oh.
Right. Uh, See, you need to understand the meaning of life or meaning in life. What exactly? At every point, I think probably, something like Maslow's, hierarchy, self-actualization or self-realization. You keep on really, extending a goalpost and probably this is the thing I want to achieve. Or in a very nutshell, I used to say, what is the meaning of life? That is an ultimate question. Everybody, probably, introspect. I would like to really, go for Albert Camus' absurdity. Albert Camus is a French philosopher, and he was awarded Nobel Prize for his literature at a very young age. He said, Sisyphus is rocking. Sisyphus, I think probably, he was asked, when he won a literary battle and he kept the god of battle under his custody and he was not releasing. And death was not happening because the god of death was in his custody. Then he was threatened to release and subsequently he was punished to carry a rock from the bottom of the hill to the top of the hill. And he was doing it in a mechanical way. Albert Camus is saying, this is how we lead our life. Probably, don't try to find any meaning in life. If you feel that you have found meaning in your life, be happy with that. Sisyphus also doing it. Sometimes he was really laughing to himself because he was retrieving the memory of keeping the god of death under his custody. Similarly, we think that we have achieved this particular thing in our life and start really attributing the meaning to that particular incident. There is no meaning in life, but be satisfied with that. That's a wonderful statement by Albert Camus. Probably that's the answer. Still, I think the meaning of life is elusive.
So, thank you so much, sir, for sharing your experiences, your insights, and perspectives with us today. Today's discussion reminds us that behind every behavior, emotion, or silence, there is often a deeper psychological reality that deserves understanding rather than judgment. We hope this conversation encourages more awareness, empathy, and openness towards mental health and human behavior. Thank you to everyone for listening. Thank you so much.
Thank you very much. Pleasure is mine.
Thank you so much.